In inpatient medical coding, MS-DRG and APR-DRG plays very important role. If you understand the concept of MS-DRG and APR-DRG, anyone code inpatient medical coding chart appropriately. As all of us know, in inpatient coding, reimbursement will depends on DRGs as well as coder. Your accuracy will be depends on your DRG application. So today our topic is inpatient medical coding MS-DRG versus APR-DRG. The objectives of this session will be, we are going to know DRGs first, then we are going to know MS-DRGs, APR-DRGs, key differences between both MS-DRG and APR-DRG. Next we will check which one to use, and we will have recap related to all these sections. So what is DRGs? So DRGs is diagnosis related groups. In inpatient medical coding, we are having two types of DRGs. One is MS-DRG, usually we will call it as Medicare Severity Diagnosis Related Groups. And another one is APR-DRG, means All Patient Refined Diagnosis Related Groups. These are the patient classification systems used for hospital reimbursement as well as case mix analysis. The purpose of both DRGs is same, but they differ in methodology and application. So what is reimbursement? So reimbursement refers to the payment that healthcare providers like hospitals, physicians and clinics receive from insurance companies and government programs like Medicare and Medicaid and few private payers for the services they will provide it to the patient. So what is case mix analysis? Case mix analysis is the evaluation of the types and complexity of patients treated in a healthcare facility using classification systems like MS-DRG or APR-DRG. Most of the time, these case mix analysis will help hospital to understand the diversity, severity and resources needed for their patients' population. Next, we will see MS-DRG. So MS-DRG means Medicare Severity Diagnosis Related Groups. Most of the time, this MS-DRG will be used by Medicare and some private payers. So what is the purpose of MS-DRG? Primarily, MS-DRG will be used for inpatient hospital reimbursement under the Medicare Inpatient Prospective Payment System. Usually, we will call it as IPPS. In inpatient coding, in outpatient coding, we will call it as OPPS for reimbursement. OPPS means outpatient reimbursement or outpatient prospective payment system. So in MS-DRG, we are having three types of severities which are based on complications or comorbidities. Usually we will call it as CCs, and also MCCs. Usually we will call them as major complications and comorbidities. In MS-DRG, we are having three severities. So without CC, MCC, with CC and with MCC. If you want to know more about CC and MCCs, please mention the comment section of this video. So exclusively I will create one video related to these severity levels related to MS-DRG. So what is the focus of MS-DRGs? So the focus will be on severity and resource consumption for Medicare patients. Advantages will be standardized and widely used for Medicare reimbursement. What are the limitations here? Limited granularity in severity levels compared to APR-DRGs. Looking for APC's local chapter webinar link for free CUs, medical coding jobs in India, USA, UAE, join in our WhatsApp group. So the group link is in the description of this video. And also if anyone looking for same day surgery coding, SCC coding, IVR coding, please send WhatsApp message to 707-526-3939. Next, we need to learn about APR-DRGs. So what is APR here? All Patient Refined Diagnosis Related Groups. So most of the time APR-DRGs will be used by Medicaid programs, commercial payers and some state agencies. What is the purpose of APR-DRGs? So more detailed classification for all patients including pediatric and non-Medicare populations. Like in MS-DRG, in APR-DRG also we are having the severity levels. In APR-DRG, severity levels will depends on SOI, usually we will call it as severity of illness, and ROM, risk of mortality. So if you want to know more about SOI and RYM, please mention in the comment section of this video. I will create one special video related to SOI and ROM. So what is SOI? Severity of illness is a classification that measures how sick a patient is and how much hospital resources they require. What is ROM? So risk of mortality is a classification that measures the likelihood of a patient dying during hospitalization. So using ROM, it will predict patient outcomes, benchmarking hospital performance, as well as determining the reimbursement process for services provided by the hospitals, physicians or clinics. Like in MS-DRG, in APR-DRG also, we are having 4 types of severity levels. First one is minor, next one is moderate, next one is major, and last one is extreme. If you want to know information related to all these severity levels, please mention in the comment section of this video. I will create one more video related to the severity levels. So what is the focus of APR-DRGs? So the focus of APR-DRGs will be more refined severity measurement accounting for patient risk and mortality. So what are the advantages? So APR-DRGs are having greater specificity in classifying patients, particularly useful for Medicaid and commercial insurances. So what are the limitations for APR-DRGs? So more complex than MS-DRG, requiring additional data and analysis in order to use APR-DRGs. So if you observe among MS-DRG and APR-DRG, MS-DRG is little bit easy compared to APR-DRG. Now we will see key differences MS-DRG and APR-DRG. So columns are divided based on feature MS-DRG and APR-DRG. So if we take the feature used by MS-DRG, Medicare, some private payers, APR-DRG, Medicaid, commercial insurance and state agencies. Focus will be on severity for Medicare patients, MS-DRG, comprehensive patient severity across all ages. Severity level, as we have discussed previously, no CC, MCC, CC, MCC, and APR-DRG we are having 4 severity level: minor, moderate, major and extreme. So next feature is risk adjustment. So in MS-DRG risk adjustment is limited, but in APR-DRG more refined, includes risk of mortality. So in MS-DRG patient population is Medicare 65 plus and disabled. APR-DRG all patients including pediatric cases. So which one to use? Hospital treating primarily Medicare patients, they will use MS-DRGs. Hospitals with diverse patient population like pediatrics, Medicaid and commercial insurance, they will use APR-DRGs. So what is recap here? So DRGs are the backbones of inpatient reimbursement. We are having 2 types of DRGs, MS-DRG, APR-DRG. MS-DRG are having few limitations, but APR-DRG will be used by any type of population. Among MS-DRG and APR-DRG, APR-DRG little bit complex compared to MS-DRG. If you want to know any more information related to inpatient medical coding, please mention in the comment section of this video. Thanks for visiting our channel. If anyone looking for same-day surgery coding training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button. If you are having any doubts, please mention in the comment section. If you are visiting for the first time, click on subscribe button. If anyone looking to learn inpatient medical coding, surgery coding and ED coding, please share this channel to your friends.